How does LPR contribute to chronic COPD cough? Imagine a tiny fire in your throat that keeps flickering and causing irritation. That's kind of what happens when laryngopharyngeal reflux, or LPR, occurs in people with chronic obstructive pulmonary disease. LPR happens when stomach acid and other stomach contents sneak past the upper esophageal sphincter and reach the throat and voice box. This can cause irritation and inflammation in these areas. When the tissues in the throat and voice box get irritated, they send signals to your brain that trigger a cough. It's your body's way of trying to clear out what it perceives as harmful or irritating. In people with COPD, which is a lung disease that causes airflow obstruction and chronic inflammation, this extra irritation can make a cough worse or stick around longer. The reflux stomach contents can reach the larynx and pharynx, leading to inflammation of the mucosal lining. Sometimes tiny amounts of these contents are inhaled into the lower airways, a process called microaspiration. This can cause further irritation in the bronchial tubes and lungs, making the cough more persistent. LPR also makes the nerves in the throat and voice box more sensitive. This means that even small irritants or minor stimuli can set off a cough. This heightened sensitivity is called cough reflex sensitivity. When the nerves are more reactive, it takes less to trigger a cough, which is why some people with COPD and LPR experience frequent coughing even when there's no obvious reason. Another way LPR contributes is through neural reflexes. Reflux can activate nerve pathways that cause coughing without any actual refluxate reaching the lungs. These reflexes are a kind of warning system that gets triggered by signals from the esophagus and throat. It's like your body is overreacting to the presence of acid or irritation, leading to more coughing episodes. LPR is also linked to abnormal esophageal motility, which means the muscles that move food down the esophagus don't work quite right. This can cause longer exposure of the esophagus and upper airway to stomach acid, increasing the chance of irritation and cough. For someone with COPD, this added irritation can make breathing more uncomfortable and worsen their cough. Because COPD already involves inflamed and narrowed airways, the additional irritation from LPR can make symptoms worse. It can lead to more frequent exacerbations, which are episodes where symptoms suddenly get worse. Managing LPR in COPD patients often involves checking for reflux, using medications to reduce stomach acid, and making lifestyle changes like avoiding certain foods or eating smaller meals. Sometimes, elevating the head during sleep or losing weight can help reduce reflux episodes. Understanding how LPR contributes to chronic cough in COPD helps doctors treat both issues more effectively. Addressing reflux can sometimes lessen the cough and improve overall breathing. So, if you or someone you know has COPD and a persistent cough, it's worth talking to a healthcare provider about whether reflux might be playing a role.